for joining today. Today is the orientation for the Disaster Response Collaborative drill kits that will be provided to Disaster Response Collaborative facilities for use in year 2. My name is Chris McCarthy. I supported, and my company, Emergency Preparedness Solutions, supported the development of these drill materials. I will also serve as a contact going forward for support with these materials as needed during the second year of the DRC. Joining me today from the DRC, I have Julie Shelton as well as Laura Aird. And Laura, I'll turn it over to you for a quick disclosure.
Certainly, these activities are part of the Pediatric Pandemic Network, which is supported in part by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services as part of cooperative agreements, 2 of them. I'm not going to read the numbers. The content presented here is that of the authors and does not necessarily represent the official views of nor an endorsement by HRSA, HHS, or the U.S. government. Back to you, Chris.
Thank you, Laura. Today, for the few participants we may have, if you can place your name, role, and organization or facility name in the text chat. This is an interactive orientation for those that are present live. So feel free to ask questions either in the text chat or unmute yourself today. This session is being recorded so that it's available for use by DRC participants as they may use these materials. So this recording will be on demand. And also today, the materials that are shown may vary somewhat from the final materials that are distributed and available for DRC teams, but the core function, layout, format of them will remain intact. So today's orientation will still work. Again, just keep in mind some of the documents may look a little different in final version. To set some expectations of what the orientation is, today it is, like I've mentioned, an orientation over the documents that are provided to DRC facilities for use in a drill or up to 2 drills in the second year of the DRC. This orientation will cover the different documents that are in the drill kits, some key components, particularly those that should be customized or updated with facility-specific information. This orientation today is not an HCEP or exercise design training in any shape or form. Today, we will not touch on any core principles of exercise design or the planning cycle, albeit we do provide several resources to the Homeland Security Exercise Evaluation Program, or HCEP doctrine, as well as myself. I will be a listed contact for you for any questions that are specific to these documents as you may use them. Some final reminders before we get started, and these reminders I'll provide later on before we conclude as well. These materials are available for adaptation and use by any disaster response collaborative participating facility, specifically for the use of DRC activities. We do ask that these materials are not shared beyond DRC teams, and we do ask that these materials are not adapted for uses outside of the DRC activities. Lastly, these materials are not available as of today, as of the recording of this orientation, and the DRC leadership team will be reaching out to DRC facilities with instructions on how to access these materials as soon as they are available. So, with that said, I'm going to get on with our screen share. We don't have any slides today, so as I mentioned a little earlier, if you've got questions or want to talk through a particular item that I'm showing on screen, feel free to type those questions in the text chat, or you can come off mute and ask those questions. What you're seeing on screen is the first document you'll encounter when the materials are distributed. And in fact, this document itself is a container of sorts for all of the remaining documents in a given drill kit for a particular topic. So just a reminder, there are 4 different topics for the DRC. Today, I'm going to show an example of one topic's documents, because all the documents themselves are the same, the different types of documents that are included. It's just the content that will vary from topic to topic. And I'll highlight that as I go through this orientation, the information that may be different for your topic if the version I'm demonstrating today isn't the topic that you've selected for the DRC. This drill planning guide will be available in PDF version, so it's easy to download. And then from there, I'll show down below where you'll access the different document links for the different components, again, that we'll review today. On the first page of the drill planning guide, you'll find some expectations of, again, what you'll be finding in this document. I do highlight very prominently here the HCEP resources that are available from FEMA. So this segment here, that red link on the page, about the middle part of the page, goes directly to the FEMA toolkit for HCEP. So if you yourself are just getting started in the world of planning or delivering, facilitating, controlling a drill or an exercise, this is your source of truth. You can go right back to that. Or if you've been doing this for a while and you just want to brush up or use some of the additional tools that we don't provide in this particular kit that are available from HCEP, again, that link is there prominently for you. Secondly, on this page, you'll see our info email and our company logo there for Emergency Preparedness Solutions. Again, info@epsolutionsaz.com. That'll come more or less directly to me. So if you have questions about these documents, particularly as you get into using them and start to adapt them, think of me as kind of on call via that email to ask those questions. If we need to schedule a Zoom call to have a quick chat, I'm available for that as well. Although I am likely not funded to, nor would you need to necessarily fly me out to your facility to actually plan or execute that drill. Again, I'm on call to help with these documents as you use them. The next segment of the drill planning guide talks about some planning milestones and a recommended checklist of planning steps. Again, these were derived and rooted consistent with HCEP guidance that you would find from the HCEP doctrine, albeit we just kind of provided a shortened version or consolidated version of some suggested steps and timelines. One note here, for instance, with the timeline, we built this on as though you may have up to 12 weeks. Your individual facility might be maybe 6 or 8 weeks out from when you wanted to do the drill. That doesn't mean that you're out of time. These, again, are suggested timelines. These are suggested checklist items that you'll find throughout this document. And you'll probably hear me say this often: adapt this for your facility's use while you're participating in the DRC. This isn't meant to be the only way to do this drill for the DRC or do this activity for the DRC. It is one way to do it, and that's what we hope to provide here. So again, planning milestone calendar, planning checklist that breaks out, some different buckets or tranches of activities that you can do if you're the one leading the planning and the delivery of this drill for the DRC. I'm not going to spend time going one for one here, but when you do get this guide, this is why this is the first document I'm showing. You'll want to read through this document in its entirety, understand the different pieces of guidance we may have provided or recommendations, so that you can decide how you're going to use that and execute on planning and delivering the drill. After the planning checklist, we get to what I would consider really the core of this document, the drill planning guide. The final version of this document, in this first column here to the left, each of these document titles, drill plan being the first one here in this table, each of those will be hyperlinks that let you download that particular document for your given topic. So for instance, it may be difficult to see, we're looking at the evacuation topic version of this drill planning guide. So if your topic is evacuation and you've gone and received this drill planning guide, in order to access all the evacuation topic specific versions of these drill documents, you'll just need to make sure you're in the evacuation drill planning guide, and then each of these links that you'll be able to click will download the evacuation topic specific version of those documents. This table covers the 7 documents that are included in each of the kits. I'm going to take some time to go through some of these the document components that I recommend you take some attention on. I'm actually going to show those documents in a moment. But before I go to showing that, I wanted to show the rest of this drill planning guide. After the instructions there for each of the drill documents, we do provide a suggested checklist for the day of the drill. So some recommended activities for drill planners or facilitators, controllers to do. Some timing for even bringing you right to the live drill here in segment C when you're actually conducting the drill. And then we continue to provide some recommendations on what to do after the drill, beginning with the hot wash right at the end of that drill or exercise, moving on to those post steps of developing the after action report and the improvement plan, and even scheduling if this was only just your first drill that you did for the DRC in year 2. We do remind you that the target is to deliver or run this drill twice in year 2 of the DRC. And that brings you to the end of that recommended checklist. Lastly, in this drill planning guide, we provide as comprehensive as we could, kind of across the 4 topics. This is the same in all 4 drill planning guides, a list of acronyms that you commonly find, and then of course, a link back to the PPN website as needed. So I am now going to navigate away from this document, but I am just, again, for the next period that we are together, again, feel free to ask questions, either unmute yourself or in the text chat. But for the rest of the time today that I take, I'm going to go through each of these documents and highlight most of the components that you will need to spend some time with, either filling in the blanks, customizing it to your facility, or some of that content may come through planning activities that you will do at your facility as you make decisions on how to plan and ultimately execute on this drill. So the first document we're going to talk about is the drill plan. Many of these documents, again, are based on, adapted from the HCEEP templates, this being one. So some of you out there may be familiar with an exercise plan. This has just been adapted into a drill plan. So the first thing that we do recommend with these and any documents where you see a cover page where you may want this for documentation purposes and you'll be saving or archiving a version of these documents, these are all going to be provided in their native form. So in this case, it's a Word document. There's no locks on there. If you want to add your facility's logo to the cover page, you can do that just the same as we've added the DRC logo on this cover page. So please do customize these documents, make it worthwhile, not just for your participation in the DRC, but again, if that serves some documentary purpose for your facility, for a joint commission survey, proof of exercise activities, again, your emergency manager or emergency management team can definitely customize these documents as much as you would like to that. I'm going to now kind of, again, scroll through some components of the document. With screen sharing, I'm going to do my best to size this, but if at any point somebody wants me to stop and look at a portion of these documents closer because you don't have these documents in hand yet, I'm happy to stop. Feel free to just pause me, again, unmute yourself or throw something in the text chat if you need me to pause and talk a little bit more about one particular component of these documents. So as we continue through the drill plan, again, you will see very consistent components if you've seen other HCEEP consistent documents or the HCEEP templates themselves. So we have an overview. This brings us to one of our first highlighted sections, and these are the ones to really pay attention to throughout all of these different documents. We've highlighted all the different sections that are a must customize or a must input. For instance, the date of your drill. You'll want this document to reflect accurately when you actually delivered the drill, when you actually ran the drill. You'll see several highlighted items throughout these documents. I'm not going to touch on every single highlighted component today. Just know that that is a definite indication that you will need to input something or customize that section before you use these documents to run your drill. We also have, for the first time in this drill plan, but you see this throughout the documents and in many different places, specific objectives, as well as specific HPP capabilities that were connected to one or more of those objectives. So in this case, today I'm using the triage, infection control, and decontamination version of the drill plan here. So you see that here in the drill name identified. So each topic may have different capabilities and will have different objectives. These objectives are based on process measurements that the DRC, the collaborative, is specifically looking to measure for facilities that are doing the drills for the collaborative purposes. Again, this is just the first time you find them, but these objectives, these capabilities are restated in multiple places throughout the documents. I call this out here because if you decide as a facility to add an additional objective, that's definitely something that you're welcome to do. We do ask that you keep at least these objectives for the purposes of measuring these things for the DRC's data collection. But again, if you add more objectives or other capabilities that align to what you're doing in this drill, feel free to customize that. But remember to care for those customizations throughout all the rest of the drills drill documents that may contain capabilities or mentions of the objectives elsewhere. I'll continue down here. Again, you'll see some more highlighted information that you would need to customize. Again, the objectives consistent with HCEP are stated in the capability matrix here in this plan. I'm going to scroll now past some of the boilerplate language that's there, which may though still include some highlights. I'm going to come down to the patient simulation section. So bear with me while I scroll. Okay. So for each of these drills, for the 4 different topics, there is some element of simulation. And in the case of 3 of the topics, we have provided a patient catalog that can help you simulate patients for the purposes of that drill. So in the case here, for this drill, for instance, for triage, infection control, and decontamination, these patient files can be used when you're triaging patients. There's some data, clinical information on there that'd be helpful. That's, again, tied back to the scenario that we describe in here that we recommend to use. And then as you move into either infection control, there may be an element of information in those patient files that make it easy to test that capability. And of course, decontamination, those patient files can be used to simulate your activities either in paper form, so just handing the paper form to your staff that's doing the activity in the drill, or if you are going to scale this up and do more of a full-size exercise at your exercise at your facility, these patient files that we've provided in the patient catalog could be handed to an actor, somebody that's a live person that you brought in to play the part of a patient during your drill or exercise. So I'm going to show the patient catalog here in a moment, but just know it's very deep. There's lots of patient files in there. So I encourage you, if you're in one of the topics that utilizes the patient catalog, I encourage you to open these tools, really assess what's in there and how you might use that to simulate patients based on the drill play that you decide on, that you plan for. So in this drill plan, the link will be here to take you to the patient catalog. There are two components to the patient catalog. First, there is an instructional document with the first tab there. Bear with me, I'm going to resize so we can see this in one place. There is a read first instructional tab here, and this provides much more deeper context on what's contained in the patient catalog, the different details that you'll find on each of the patient data cards. There are 30 patient data cards, 26 of which are children patients, school-aged, elementary school-aged, and then there are 4 adults included in those 30 patient data cards. And then there are there's a total of 28 family member data cards. We've even thrown in a couple of family data cards that don't connect properly to a patient. So if your topic is reunification particularly, and you're testing, matching family member data that comes in through your reception site, matching that up to the patient data that you might have had from triage or from the care or that you were providing, there may be some family members who don't actually connect to a patient, or there's a reason why they aren't the right family member to reunify with that patient. So again, that's a nuance that's specific to reunification, whereas that may not come up in a decontamination drill. So please do read through these instructions we provided specific to the patient catalog. The next page of this instructional document is a full data table. So it's numbered by the patient number, and you have across in each row the different components that you would find on the data card. So this just consolidates all that data that's on each of the cards, and then it provides the name and the data that you'll find on the correct family member card. So these family member cards aren't named. You as a controller will need to be able to match up. If you provided patients 1 through 10, then as a controller, you'll need to use these same family members that connect to patients 1 through 10. And then for a look at what those data cards actually look like, I'll flip back over here. Here's an example of the first data card. So again, this is patient 001. I'm going to go back to the table here. This is that first patient we see here at the top of the table. The patient name is Carlos Rodriguez. And so if I switch back to the data card, you'll see that we may have a name for the patient. We may not have a name for the patient. So in this case, this is a category red. So this patient is likely injured to the point that they're incapacitated, can't provide a name. So the patient card may not have a name, but it will have some additional identifying information, additional information about the care that was provided. And then in the case of reunification, you'd be trying to match this information compared with if you were using these patient files for the purpose of triage or decontamination. The family member card may not be as important in that case. So you're more focused on, on the physical findings. What was the patient's condition at the scene. As we move into page 2 here of the patient data card, you'll have more clinical information that the hospital staff, either your decontamination staff or even once you get them into the ED, the clinical information that clinician, nurse, doctor would need to have to make some decisions about the care. I'm going to pause for a moment just for the benefit of our live guests, see if there's any questions about the patient catalog that I've covered. Okay, I'm going to keep moving. I'm going to return back to the drill plan and make one last note about customization here. So as you go into the drill plan and get to different appendixes, or again, even for other sections of the drill plan that may be provided above here that we've already covered, if it's not applicable to your drill, how you're going to conduct the drill or how you plan the drill, then you can delete these sections. Again, this is built on the HCEP recommended templates. As HCEP states, that it's not an end-all be-all. It's not a must-use every time, no matter what. These documents, again, especially where there's highlighted sections, these are meant to be adapted and customized to your facility for the DRC purposes. So that even goes for any timelines. We'll get into the scenario injects that we have recommended, but even then, we've timed those out as a suggestion. If you decide that you want to time these differently, shorten them, lengthen them, modify them, again, that's where you have that control or that ability as the drill planner. The next document I'm going to go to in the list from the drill planning guide is the MESL, or the master scenario event log. Again, bear with me while I resize this. And just to connect it to the documents we reviewed, from here on out, the version of the documents that I'm sharing is triage, infection control, and decontamination. Again, a reminder that the details, for in this case, the injects that are in here, those are going to be different for all 4 different topics. So again, calling out, you'll want to read through each of the injects that we've provided and ensure that they seem realistic, or if you want more detail in there, more specificity to your facility, that you update these injects with that content. But as with other documents, we've highlighted, some fields that you definitely need to update or input something into: the facility name, department name, if applicable, and the drill name. Each of the MESL forms, the master event scenario list, they have this first row, which serves as an example. So this isn't an actual inject that is suggested for the drill for a given topic. This example line is always there, and you can and likely should delete that example before you actually use the documents or finalize the documents. You'll see in this MESL, again, it's been adapted from the HCEP template. So we have different columns here across the top. We've numbered the events in sequence. We've provided simulated timing for when these injects could happen over a 3-hour period. So again, if you decide to run your drill in 2 hours, or if it's more of a full-scale exercise that may take 4 hours, you may need to expand or contract these different injects, or the timing at least, so that you can accomplish the target time that you are planning for in your drill. Just keep in mind, these are a suggestion. These, again, the remainder of these fields here are consistent with HCEP, where you have, who is sending the message, whether that's a live player or a simulated entity, to whom that message is going, what that inject message is. As a controller, what expected action you would expect out of that player who received that inject, what may happen next. Gives you, who is going to be playing that role. Is it somebody that's in the exercise, or is it going to come from a simulation cell? Again, who is responsible for that inject or providing that, the point of contact, and some additional notes that, we've again provided some additional notes here in this last column that help connect some of these injects if you're looking at it for the first time. But feel free to annotate, update, change these injects however they best fit for your facility. If when you get into the planning, you decide you want it to operate a certain different way. As with information that is going to be found in the drill plan, these injects are used in other documents as well. So just keep in mind, if you change something here in one of these earlier documents, and I'm going in order of use, if you will, so use the drill plan document first to get started, and then when you get to the point that you're ready to plan out the injects, the MESL is next, and then subsequent documents will likely pull information from the drill plan or the MESL. So you just need to make sure you're caring for moving that information or customizing that information across all the documents. The next document that we'll review is the Controller and Evaluator Pocket Guide. This is not the exercise evaluation guide. I will go through that EEG, as it's referred to as a short name, but that exercise evaluation guide is different than the pocket guide that I'm about to show you. So that controller and evaluator pocket guide is just that. There's a companion, there's a player pocket guide that I'll show a bit later, but this document is meant to stick in a controller or evaluator's pocket. It's got some of the most important roles and responsibilities. Who are these, some definitions of who these people are, but more importantly, contact information for like the exercise or drill designer or director, any lead or senior controllers, site controllers. Again, this document is built to be adapted. So you might not be running a full-scale exercise. You might just be running it as a drill in one unit or a couple of departments. So this list may need to be modified, expanded, contracted again to reflect what's actually happening in your drill. But again, this is meant to be that pocket guide for a controller or evaluator to carry around with them if they need to remember, again, some big milestones of the measle and where they need to be on track with timing. That's why we've designed this pocket guide as more of a quick tool rather than the more standard HSEEP tools like the EEG or the drill plan. So this way, an evaluator or controller isn't carrying around a 17-page drill plan in their back pocket. It's just this couple of pages or a few pages, depending on how much you add to it. The next document is the exercise evaluation guide workbook. So this is more in line with the traditional HSEEP design or template that they recommend for an EEG. Again, each of these is DRC topic specific. So you'll find here on the first page of each of the EEGs, just to confirm that we're looking at the right topic for your given topic when you download this. Just like in the drill plan, we call out the HPP capabilities that might be addressed or connected to the process measures, the objectives that we have on this EEG. In the subsequent pages, these are those objectives as a measurement. So if you recall, when we were looking at the drill plan for triage, infection control, and decontamination, there were 4 objectives. And all 4 of those objectives are each based on a process measure that the DRC is trying to collect data on for the collaborative purposes. So each of those objectives as a measurement is described here. It gives the details on what needs to be measured. So in this case, again, I'm just using this as an example from triage, infection control, and decon. This first process measure is the time from notification that decontamination is needed until the decontamination area is ready to receive the first patient. So an evaluator would be, watching the clock and marking, okay, what time, either from the instant command or at the ED, whoever's running that, what time was the decon team notified, hey, we need to set up our receiving area for patients. So that's what time they received that request or initiated that setup of the decon. And then the evaluators, the second timestamp they're looking for is, okay, we're ready to receive the first patient into the ETA. So they'll mark that time down. And then we provide how you'll calculate what measurement we're going for. In this case, we're looking for the time from that notification to the time, or the amount of time it took from notification to the decon area being ready to be set up. So we do the quick math on those timestamps, and we get that time measurement for this first objective. I'm going to show in a bit the after action report, where you'll see where that information, as you calculate it here on the EEG, it's going to be real easy to pull that one data point for each objective or measurement out of the EEGs to put in the after action report. And then of course, for each objective, there's observations, so that evaluator can be making their free form comments on, this is what was working, this is what I observed as they were setting up the decon area. So that again, the after action report will provide some spaces to collect that information from the observations as well. I'm not going to go through the rest of these, but again, they all generally follow the same format of one process measure per page here in the EEG, and then that information will be easily transferred over into the after action report. The next document that I'm going to go through is the player briefing slides. So this is a PowerPoint, and again, bear with me while I resize for us here. This document, like others, has several highlighted areas that you as an exercise planner or the controller will need to fill in before using these. This is the slides that a lead controller or exercise planners would use in the briefing with players. So before the drill or exercise starts, this document, again, will pull information from your drill plan, possibly from your measle. So again, that's why these are in order. I'm going through these kind of in order, in the recommended order of use, because for these blanks that, or rather these highlighted areas that you see in these slides, you will have already determined this and likely should have documented this information elsewhere, like in the drill plan or the measle. As with the other tools, again, if your facility has other specific information for scope and purpose, or if you want to add your logo to these slides, or have some specific housekeeping separate from safety and security, again, you can add to these. We just ask that you still maintain, the minimum information that's here. This is consistent with HCEP, so at the very least, if you just fill in the highlights here, you'll have enough to do that player briefing before the drill. All right, there are two more documents we're going to go through, and as always, if you've got questions, feel free to stop me, either unmute yourself and just ask, or you can pop those questions in the text chat if you're live with us. The next document is that player pocket guide. So if you recall, we went through the controller and evaluator pocket guide. This one is a little bit different in that we tried to keep it to a single page. So depending on how much additional information you might add or customize in these highlighted sections, our goal was to keep this to a single page so all your players, again, could have something in their back pocket if they need to refer to communication standards or conduct or contact information, that little player card can stay in their back pocket if they need to refer to it. The last document that I'm going to review, and the last document that's in this kit, is the after action report and improvement plan. This is another document that follows closely with the HCEP templates that they provide, albeit we've adapted and customized it for the purposes of the DRC drill. So again, these are topic specific. You can customize these just like with the drill plan. You can put your logo on the cover page here. The highlighted areas are where you should update or input some information. As it is with the HCEP template, again, you'll see this same drill overview section. This is word for word. It is like for like what is in your drill plan. So if you've already completed the drill overview, this table of stuff here in your drill plan, then you're just cutting and pasting to put it into this after action template rather than trying to recreate it or retype it out. After the drill overview, you get into the analysis of measurements and capabilities. So we've broken it like we did as I demonstrated in the drill plan. Each of the DRC process measurements are those objectives for the drill. So we've here provided a more clear connection between those process measurements and those capabilities that they may touch on in the case of HPP capabilities. I said this earlier, but bear saying again, if there are other types of capabilities that you're testing here, other objectives, you can add them. That's why we provide at least that one additional line with the highlights here, indicating how you can continue to just add lines or objectives if you have them. But also if you have other players, if you have public health partners that are also planning this with you, and you want to connect a FEP or public health emergency preparedness capability, again, adapt this for the use of your facility. We've just built this in a way that if it's just the DRC process measurements and capabilities that you're looking for, those are all there for you already. Beyond that, you get into the specific process measurement outcome. So I'm going to flip back now to the to the EEG, the exercise evaluation guide. And as I showed here, we had this first process measurement for triage, infection control, and decontamination. The 2 timestamps were observed by the evaluator, and then you have the number of minutes it took until the decon area was ready to receive a patient. If we go back to the after action report, you'll see time of notification that decon from the time that decon is needed to when it's set up. You put that measurement in there. If it was 15 minutes or 20 minutes, you'll pop that number in there. And then here you have some free-form typing where you can consolidate the observations that you got from various evaluators on that particular process measurement. And then even as many I shouldn't say most, but many evaluators have, they may have even given you some suggestions of, maybe to change this or do this differently. And that's why we've built that to collect all of that from those observations you may have gotten on the exercise evaluation guide. You have however many in this case for triage, infection control, and decon. There are 4 process measures. So you see those 4 process measure tables there that are available for you. And then lastly, the Appendix A, which is the improvement plan. So by capability, you can go in here, for whatever capabilities that you're going to have an improvement plan around those different measurements. We've got you started with that table, but as with any of these tables, you can add additional lines as you need. And then lastly, we give the standard attendance sheet or sign-in sheet appendix. You can use this as your sign-in sheet, or if your facility has other formats for sign-in sheets or attendance. I went to an exercise the other day and I had to scan a QR code to sign into the exercise. So again, adapt this for however your facility might typically conduct a drill or an exercise, but at the very least, the sign-in sheet drill participants is there for you in the after action report and improvement plan template. That brings me to the end of my demonstration. That gets us to the last document here in the drill instructions. I'm going to stop sharing screen for the moment and turn it back to the group and see if there's any additional questions, comments. If you want me to look back at a particular document or a piece of a particular document, I can put that back up. I'll open it.
Back to the planning guide, the first document that has all the instructions, and then we'll have the links out to the documents and just kind of reiterate what everything you showed will be linked from that document. And
yes, thank you. Yeah, I know some people joined a little bit in and may not have seen me talking about this. So this is the first document. Again, I'll scroll even to the front page. This drill planning guide, there will be 4 versions of this. So 1 version for each topic. In this case, the one that I use for demonstration today is the evacuation drill planning guide. And going back to the table that Julie was just mentioning here, the drill kit instructions, it lists those 7 documents that I was just demonstrating on screen a moment ago or finished demonstrating. And right here in this first column, this isn't the final version, we're still building the links, but each of these titles here for each of the documents in this first column, those will be a hyperlink, and that's how you'll download each of these documents.
I want to thank you for putting all of this together. I think that they look very user-friendly and very helpful. I really appreciate the controller guides that, for the process measures and how that ties into after action report. That's, I think, going to be really useful for our DRC participants.
Great. And on that note, feedback too. I don't have an ego about these. So if you saw something, again, that you either have a question about or even have a suggestion, I'm open to it. Even if you don't want to say it here, you can, again, contact me. As you and the team start to use these documents, again, that's why I'm first and foremost here on the first or second page, if you will, of this drill planning guide to ask the questions. But if you've got additional feedback about it as we go along, I'm open to that too. Thank you. All right. Not seeing any other questions or hands, so I think we can conclude this session for today, and we'll see you all in the future.